Most people are worried about their weight and they're concerned about carrying excessive body fat. Well, the thing about it is, if you look at the data long term and you look at the difference between some extra body fat versus a loss of muscle mass, it becomes a bit fuzzy, especially as you get into your elderly years. Which is more problematic? Is it worse to go into your elderly years carrying extra weight or carrying a lack of muscle? And the debate is kind of on, because a loss of muscle mass is something that typically occurs in just about everyone. If you look at the data overall, most people begin to lose significant amounts of muscle after the age of 25 or 30, maybe as much as 1% lean mass every year, and that can accelerate as you get into your 50s and 60s. So losing lean muscle becomes increasingly a real thing as you get older, whereas gaining fat tends to be more of an issue. You tend to see the average person gains maybe 1% of their body fat, or 1% body fat every year after the age of 30 or 40. It's of course variable to each person. You can certainly say that increased visceral fat is probably the most important problem, but as time goes on and you look at the difference between less muscle and more fat, it's quite clear that going into your especially your later years with less muscle is going to be maybe even the more important problem. And there's a few reasons for that. Muscle is the main, you can call it the sink for carbohydrates. So if you say, why do people end up on low carbohydrate diets? Well, part of it is that they lose carbohydrate tolerance, and the loss of carbohydrate tolerance has a lot to do with not having enough muscle to soak up your carbohydrates after your meal. If you have enough muscle and you eat a meal with carbohydrates, there's plenty of room for those carbohydrates to go after the meal if it's a reasonable amount of carbohydrate. But if your muscle mass is very low and you eventually develop what we call sarcopenia, which is clinically serious loss of muscle, then it's going to be very hard to maintain normal blood sugar regulation. So muscle mass is very important for probably the single most important problem in our modern society, which is insulin resistance and blood sugar dysregulation. And it's also, of course, important as time goes on just for your overall function. As you get into your older years and you find you're stiffer and more in pain, a lot of that reflects a loss of muscle mass. Muscles tend to deteriorate with time if they're not specifically exercised, and they start to hurt. Most of the pain in our bodies comes from muscles most of the time. People with chronic back pain that have maybe arthritis, they may think it's all from the arthritis, but probably 80% of the pain in most cases is actually from the surrounding muscles. Same with arthritis in the hips and even in the knees. It's often the surrounding muscles that cause more problems than the arthritic joint itself. The other thing is that muscles that are exercised regularly secrete hormones that are vital for your body. Just like the visceral fat, the fat inside your belly and inside your organs, secretes, if that visceral fat expands, it starts secreting what we call adipokines. These are substances like TNF-alpha and IL-6, compounds that elicit an inflammatory response in the body and have a detrimental effect throughout the body that cause probably the kinds of aches and pains you feel as you get older or as you gain weight are coming to a large extent from these things. They drive cardiovascular risk because it causes endothelial dysfunction. The lining of the artery starts to become weakened and damaged from this low-grade inflammation. And a big part of the harm that comes from the visceral fat expanding is the inflammatory cytokines in the brain. That's where depression and potentially long-term risk of dementia is coming from, largely from these adipokines. If you grow muscle and you maintain a healthy, active muscle mass, those muscles secrete compounds called myokines. And myokines are almost like the opposite of adipokines. Adipokines are mostly negative and detrimental. There's a couple that are maybe good for you, but essentially they're mostly negative and detrimental, whereas the myokines are hormone-like substances that are kinds of compounds that help the brain to improve its function, that have brain neurotrophic effects that result in better neuroplasticity, that maintain neuroprotective effects in the brain, that help you to maintain better mood and to feel just more energy and that sense of vitality. That comes from the muscles. And realize if you've never done it before, maybe do the experiment of starting a a modest weight training program. If you're an older person particularly, you're probably going to benefit even more than the person that's in their 20s that wants the six-pack abs. The people that benefit the most from weight training are people that are elderly that have sarcopenia. So in fact, if you were to isolate the group that has the most benefits of weight training, of any group, it's nursing home residents. So nursing home residents can improve their strength and show more medical benefits from weight training than any other identifiable group. But if you're anybody that's, getting into your 50s, 60s, heading to 70 like me, weight training is going to give more tangible benefits than anything else you'll do probably. If you get into a regular regime of doing some weight training, it doesn't have to be extreme, but it has to be regular. You'll probably notice that your mood is elevated, that your sense of vitality is improved, that if you have aches and pains and you work those achy, painful places, the aches and pains tend to dissolve away, and you'll probably find that you'll feel better than you have in a very long time by doing some regular weight training. And in the end, it's probably one of the best things you can do for yourself, bar none.